There are many different types of disorders and a number of ways in which psychologists go about understanding and treating them. Four of the most common types of mental disorders are anxiety disorders, mood disorders, autism spectrum disorders, and schizophrenia. Psychologists look at biological, psychological, and social factors when studying and treating these conditions.
Major depression is a disorder that can be described as a person who experiences persistent low mood and affects that person's ability to function normally. Biological component of depression has to do with disruption of sleep. So this could be not having enough sleep, which is insomnia, or sleeping too much, or disruption of one's appetite, affecting that person in terms of gaining too much weight or having weight loss. Psychological component. A person may feel sadness, hopelessness, or thinking negatively or pessimistically. The social component. Lack of interest in the things that one normally enjoys, and also withdrawing from friends and other social activities.
You're absolutely alone. You feel you are alone. You feel absolute worthlessness. You feel that there's no hope in the future. You believe everything is dissolving. You feel your marriage may be dissolving, relationships with children may be dissolving, all this kind of thing.
Anxiety disorders is a group of disorders that's characterized by three general categories of symptoms. The first being having physical symptoms of anxiety or fear. The second, unrealistic anxiety or cognitive distress. Third, escape or avoidance behaviors. Anxiety disorders can be described in the following three components. Biological. Some of the symptoms can be having racing heart rate, increased blood pressure, or muscle tension, what we normally think of as stress, or nausea, for example. Psychological component. Worrying that's out of proportion to the situation. Generalized anxiety that gets in the way of one's normal functioning. Social component. Fear or being afraid to be around other people and other impairments in various social situations.
I imagine that people are watching me. They're watching me stumble in my efforts to articulate. And typically I'm very articulate. But in that setting, I can be almost rendered mute.
Schizophrenia is a severe psychological disorder that can be described by a person who has disorganized thinking, perceives things differently, and behaves differently. In terms of the biological component, a person may have lowered or diminished facial expression, or sometimes their facial expressions might seem frozen. They may speak in a very monotone vocal tone or a monotone voice, and some of their physical movements or gestures might be repetitive and unusual. Psychological component. A person may experience delusions, which means abnormal thinking or beliefs about something. Hallucinations, which means seeing or hearing things that they normally shouldn't be seeing or hearing. Paranoid thinking about things that actually aren't real. Disorganized thoughts and speech patterns, where it's hard to connect the dots from topic A to topic B to topic C. Social component. Impaired ability to identify emotional states of other people. That is, they have a difficult time reading other people's emotions. And oftentimes for themselves, they may show inappropriate emotional responses, or sometimes a lack of emotional responses, which is often called flat affect.
Paranoid schizophrenia.
Okay. And can you tell me what are some of the symptoms of paranoid schizophrenia that you are suffering from?
Occasionally I hear voices in my head.
Okay. What kind of voices are they? Can you tell me about the voices?
You know, I have all kinds of companions, some fictional and some non-fictional. I had lost all contact with reality. When I don't take my medication, I kind of lose contact with reality.
In what way?
I mean, I start having delusional thinking.
Autism spectrum disorder. This is a group of disorders consisting of autism, Asperger's syndrome, and other developmental disorders. Combinations and severity of symptoms vary amongst individuals. The biological component. Person may experience abnormal neurological development, or sensitivity, unusual reactions to sounds, smells, tastes, or sights. Psychological component. Repetitive or obsessive behaviors, inflexible adherence to routines or rituals. Social component. Impairment in using spoken and nonverbal communication, meaning that they do not speak and use hand gestures the way most people might. Impaired ability to understand other people's feelings, so in this case they would have a difficult time reading what other people are expressing emotionally.
You don't know what they're really capable of. They continuously surprise you.
Right. You weren't sure he'd ever talk, and now he's talking. You
Yeah,
don't
yeah.
know if he'll be able to learn more.
Yeah, he he can work the DVD player better than I can. And he can zoom in. He knows how to. He figures all that stuff out to them, so he's able to entertain himself. But you just you never know with spectrum disorder, and it's just very it's difficult, and you have to understand that people have to go through a process when they hear the diagnosis. And I don't think a lot of people understand that. They just assume, well, you know what it is now, so just deal with it. And it's not that easy.